HealthCare Community Connection is sponsored by UK HealthCare.
Welcome back, and it's time for an eye exam for our latest UK HealthCare Community Connection.
That's right. With us today is Dr. Brad Tannen. Dr. Tannen, tell us a little bit about introducing yourself, about where you're from, your background, and how your role at UK HealthCare.
How do you want us to see you?
Oh,
we're going right down this path.
Yeah, I warned you.
Thank you guys so much for having me. It's just a pleasure to be here. I'm coming to you, I've been here a month in Lexington, and I'm just thrilled to join the University of Kentucky. I come from the University of Michigan, where I was for the last 8 years. I am an ophthalmologist by training, and I subspecialize in cornea disease. I treat patients of all ages with corneal problems, and that could range from infections to congenital problems and to genetic problems, and I do surgeries ranging from cataract surgery to cornea transplantation. I'm thrilled to join this really awesome eye care department at UK, and they have done such an amazing job and had transformative growth in the last couple of decades in providing awesome care throughout the entire state.
Yeah. You mentioned that growth. What is your vision for advanced eye care at UK?
Yeah, so first I really want to laud them because they have grown along the three arms of the things that we really care about. And the first is, like I said, patient care throughout the state, not just here in Lexington, but really distantly throughout the state. And I'd like to talk a little bit more about that. But then secondly, we are here also as an academic program to train the next generation of eye physicians and eye care providers. And so we have residency programs and subspecialty fellowship programs that are just tremendous. And third, we care a lot about doing impactful research to try to advance knowledge in the field.
So what's that thing that you want to specifically talk more about?
Yeah, I want to talk about our outreach because it's really impressive here at UK, both UK in general and eye care specifically. So this is a real problem, right, around the country, but in Kentucky specifically. And like, how do we provide good care to people that don't live as our neighbors here in Lexington? And Kentucky's a big state, and it's a long distance to travel. And many people just don't have the resources to do it, or they're taking care of families and they can't do it. And so the University of Kentucky and academic centers like UK have this special kind of power to bring resources together in a diverse manner to help care for these populations. So UK has got facilities that ring the state, and then they have partnerships with local communities and local community providers distantly. And almost all of our providers in UK healthcare and UK eye care go to those sites. In fact, you might think that that's a burden, but people really love it. It's so rewarding to go out and be able to provide that care to people the same way we can here in Lexington.
Are you taking new patients? I'm asking for a friend, meaning myself.
You are welcome anytime. Definitely taking new patients, yeah.
Well, we're excited to see how you grow UK healthcare. And are you sure you've only been here a week? You already understand how Kentucky loves to help Kentucky.
I mean, that's part of what drew me here, honestly. I mean, people really are aligned along this mission. And just to talk about like numbers, because I think they're so impressive. Last year, and I know this because I've been researching a little bit in the time that I've been here, but we had 140,000 eye care visits last year. A full 40% of those eye care visits were done outside of Lexington, okay? So, you know, 60% at our mothership, but thousands and thousands of visits into these rural communities. And what I'd love to see is, like, technology has advanced so much, both computer technology and technology to connect us. I'd love to see that become more interconnected and really try to realize this goal of telemedicine where we can bring people closer together, support those local communities, and have not only the ability to serve the state of Kentucky, but really be a leader for the nation in solving this vexing eye care problem.
Your vision for the future, the way you see it, is extraordinary. And not only are you going to be helping those smaller communities, we got to get you out there to explore them because there are a lot of unique parts of Kentucky.
I'm all in on that. So I'm ready to go road tripping.
And a hot brown. We got to get you a hot brown. All right, we'll be right back with the final half hour or so after the break. Again, thank you so much.
Thank you so much.